are starting a new clinical trial in a week's time, so we're very excited about that.
People, as
With
we
people.
point out, we're actually treating
Yeah.
people instead of animal models or cells or humans.
So we get to actually work with patients with depression and actually implement the new low intensity simulation that we've been working on to see if we can actually use that with the patients themselves and see if we can provide better outcomes than they currently get.
So are they patients who are already receiving TMS?
So they're already
Or-
scheduled to start TMS, but
Right,
they haven't
they
actually started
haven't.
yet.
Yeah.
Yeah, so on the first day that they come in to actually chat with the clinicians and sort of get that baseline talk with them, we're going to then also talk to them and say, look, you're about to start your treatment, this is another option if you'd like to join our trial, and we'll explain everything that's going on to them.
Yeah.
And then if they want to join and agree to it, then slot them in and get started.
Cool. And do they have any other forms of intervention, like sort of are they taking antidepressants, or is it something that you just have a clear slate that you're starting to see what?
Yeah, so the patients that come in to get the TMS, they are usually treatment-resistant patients. So what that means is they've tried usually a medication or a couple of medications before, and that hasn't worked for them. Yeah. So then if that doesn't work, then we're giving rTMS as another option for them.
Yeah.
So I think they might be on...
I think it's not a problem, and normally
Yeah.
when you stop antidepressants it can be problematic. So often with TMS people just say, whatever you're on at the moment, don't change anything, keep going.
Yeah.
So that's actually something we need, thank you.
Yeah.
We need to check with a clinician to make sure that we have a record of that for our trials so we know what's happening.
Yeah. Because I think at the end, when you know all the research continues, I think one of the best things that we also want to look into is, you know, can we use rTMS as a single treatment, as you said, like without having other medications or other therapies, but also what it's like if we combine the two. Because if they work together and if there's no adverse effects from that, then if both of them work and combining them provides even better outcomes, I mean, that's perfect. So yeah, it's another one of the things I guess to look into further down the track.
Can you just tell me what rTMS means again?
Yeah, so it stands for repetitive transcranial magnetic stimulation. Actually, there's a coil that's sort of like this big.
Stimulation?
Yeah, that's right. And you place the coil on top of the person's head, and the way it works is there's a magnetic field created in the coil, and that magnetic field will induce an electric current in the brain, and then the electric current is sort of how all those mechanisms work to make the treatment actually work with the patient. So the coil is just placed on top of the head. You might feel a tap sort of sensation, but it means that it's not invasive, like you don't have to do surgery or anything on the skull, so you don't have to go into the brain. You can just get the coil, stick it on top, which is a lot better.